The biggest problem that elderly patients have with dentures is instability. So usually with those type of problems, the first thing that we do is check the fit of the denture, make sure that everything is touching where it's supposed to, it's not touching early. We check the bite, and if all those things are doing well, usually my first step is to ask about the use of any adhesives. Whether it's gel or powder. Probably the best thing for instability in dentures is having a little bit of retention that actually is into the bone. So dental implants provide that for people, and oftentimes the lower dentures, the number one complaint, and even as little as 2 dental implants in the lower can provide a lot of that retention so that the denture doesn't pop up. It's not coming loose when they're talking, it's staying in place when they're eating. That would definitely be the number one thing that helps with stability. Dentures to fit well is a very involved process, and like anything that's done well, it takes time. Usually involves multiple impressions and sometimes as many as 5 to 6 appointments just to get the right fit of a denture. But a denture has to fit really well from the beginning for it to fit well in the future. So dentures in the Brookings area usually range between about $1,500 and $2,500 per arch or top and bottom. So that's somewhere in the $3,000 to $5,000 for just the permanent dentures. That doesn't include extraction of teeth or the healing dentures. Healing dentures tend to be more in the $500 to $1,000 range for a top or for a bottom. In general, a pair of dentures tends to last about 3 to 10 years. So I've seen dentures in my clinic here that were made 45, 50 years ago, and they're still doing really, really well. Dentures are very prone to breaking, falling off a top shelf. And dogs and cats really like them, and so unfortunately we see dentures sometimes on the younger side of needing to be replaced because they had some type of accident.